Lygia Ricciardi at the Digital Health Live Studio at CES 2019. I'm here with Nate Treloar, who's the president and co-founder of Orbita, Inc. Welcome, Nate.
Thank you. It's nice to be here, Lygia.
So, Nate, tell me a little bit about Orbita.
Well, Orbita is a software company based in Boston, and we work at the intersection of healthcare and this next generation of voice-assistive technologies, exemplified by things like the Amazon Alexa and Google Assistant. So our clients are healthcare systems that are trying to improve patient engagement, clinical efficiency through new user interfaces powered by voice.
So could you give us a couple of examples of how that's working, like engaging people around what activities and through what mechanisms?
Yeah, well, the one that people are most excited about is home health care applications. So aging population, people at home, our parents, elderly, they are exposed to digital healthcare technology that frankly doesn't work so well for them. Smartphones are too small or too confusing, being able to connect to the Wi-Fi. So voice assistive.
Or too big for the purse if you're my mom.
Yeah, I haven't heard that one, but I believe you. The point is that voice and voice-assistive technologies remove a barrier for engagement for these kinds of individuals for one reason or another, cognitive, physical reasons, can't use traditional digital health technologies. So that's the general category of applications. And there's a whole bunch of other ones that go right into the hospitals and all kinds of other applications.
So in home-based voice-assisted scenarios, what kinds of things what are you prompting people to do, or what are they using the interface to help them remember to do? Or
yeah, well, there's a spectrum of them. The simplest application is just educational information, and that can be, what should I do if this happens? And post-discharge use cases, what do I do if I start feeling pain in the wound? And so being able to ask that question without having to call the doctor and try to schedule an appointment is one very simple use case. Another very high value use case is medication adherence, reminding them to take their medicine, having a virtual assistant that can be there to say, hey, it's time to take your morning medication, it's time to do your therapy, et cetera.
And do you or others in the industry have data on efficacy rates and the impact that something like a medication adherence reminder has?
Well, there's plenty of data about medication adherence, but specific to voice technology, the data is still coming out, but one of the data points that has come forward is that elderly are more likely to engage with a voice-assistive technology than they will with a smartphone, a certain demographic. So that data is out. Independent of the actual use case, that data is out. And so by extrapolation, if it's a medication reminder use case, are they more likely to adhere to their medication if they're hearing it versus seeing it on a smartphone? And the assumption is that they'll hear it.
And how are people feeling about, particularly elderly populations, feeling about interacting with a non-human voice? Are there kind of barriers, or are people really open to that? Do they like it?
Well, everybody's a little different, but on the whole, they are more inclined to engage with it. I remember speaking with this one elderly woman who said, I know she's a robot, but I think of her as a person. And so there's an element of voice and voice-assistive technology that touches on healthcare that we often ignore: loneliness, isolation. And you'd be surprised how somebody who's 82 years old and living alone will warm to a virtual assistant, even if she doesn't have all the answers, isn't necessarily as personal as an actual human.
And what are you imagining you might see as, what are some emerging trends that you think we might talk about if we sit here together next year?
Yeah, well, staying in the voice arena, one of the things that we're starting to see a lot of interest in is understanding more about what's in the voice. When you and I speak, there's information that's in our voice, and we can hear it: mood, emotion, that sort of thing. So, and analyzing that and having software to actually analyze that is an emerging industry, and I expect that to really flower.
That's really exciting. I will look forward to hearing more about that. Pun intended.
Yes.
Thanks for joining us today, Nate.
Thank you, Lygia.
This is Lygia Ricciardi with Carium at the Digital Health Live Studio, sponsored by Living in Digital Times. Thanks.